Theo, my man.
What's going on, Whoa?
What's going on? How you making out, bro?
We're making out well, man. Can't call it.
I am so happy to see your smile, man.
Happy to see you, bro.
All right. And for the record, this is my brother-in-law, so we're happy to have this conversation here tonight. And I guess let's start from the top, man. I guess could you, and we're not going to ask for specifics, but could you tell us a little bit about what you do?
Currently a bus operator, and so transport people to and from where they need to go. Right now, the way we have it set up here is we have it where everybody enters in through the rear door. Nobody's really coming in through the front unless you're a wheelchair passenger or somebody really critical that needs our assistance in that way. So we don't have much contact with passengers currently. Nobody's utilizing the fare box, so that's no reason to be up front. And we basically the first 2 or 3 seats basically cut off, so mostly everybody's sitting in the back.
Okay, so let me start. That's interesting, and I'm going to ask some more questions there. But let me start with this question, man. When COVID hit, right? Like and it came specifically to your area, which is Boston. How did you feel about your job and working directly? Like you're working every single day with hundreds and hundreds of people. So so how did that make you feel? Like what was it? I'm just curious your thought process when that started to hit.
My thought process is a little bit different. I mean, my background, so it's not something where I wanted to run away. I didn't have any sense of fear in that kind, in that sense, if you will. Obviously my wife did, but I personally didn't have that fear. You had a mask. She made a mask. You had your gloves. It took a little while before everything was on board, if you will, in terms of how the company that I work for, came online to make sure everybody had everything. But my wife was taking care of me, and I was taking care of myself while I was out there. So I didn't have that kind of fear. Do we deal with a lot of people? You're dealing with the public, so you're dealing with everything. Do you have fear? I just don't operate like that. They're the same people who I see every day. I didn't have that fear.
So there was never a moment like, because I think even for me, it was a weird thing of transition of finding out about it. I was still traveling a little bit. My wife as well was like, why are you flying?
Right.
And it wasn't until like this moment of when it was hitting New York City pretty, rapidly, did I actually realize like, holy shit, this is a little bit crazy. Right. So I'm curious to know, how did your job, like what was different about your job today than it was 3 or 4 months ago?
Well, the difference was that you certainly started seeing less people traveling. And then, of course, when the governor came on board and basically shut the state down, and only if you were, an essential worker, obviously you had to work, that's when you started noticing.
Right.
What I personally started noticing was the level of homelessness that we have, because those are the people that were essentially on your service at this point. And the difficulty, shall we say, in terms of how they were going to navigate, because you were taking your nurses to work, in the early morning, or depending on their shifts, you were taking the hospital workers, the people who worked in hotels, and then all of a sudden the people who worked in hotels or restaurants you didn't see anymore. So it was really just homeless and nursing, and even the kids weren't. The kids before would go to the mall, they'll be running there. You didn't even see them anymore.
Right.
It was a very odd feeling. I will say, just to see, like, in a drop of a hat, nothing was happening. Nothing.
So interesting. Now, earlier on when you first started, you had said that there had been some procedures that were put into place. You said closing off a couple aisles. And like, how did that? Was it a long time before you got to that point?
Yes.
Was there a period? So in the period where you didn't have those protocols,
Right.
What were you doing anything differently, or were you just kind of like, I guess I got to deal with it?
You engage people in the way that, that they engage you. Some were trying to come up a little bit closer, like they would normally do, and then you would have to advise them, please, stay back. The seniors you had to be very gentle with, because they were still going back and forth. But the adults started picking up. But you have some, some reckless people, in terms of, I don't have any place to go. I don't, can I ride the bus, essentially? And you don't say no, because where are they going to go?
Yeah.
So it was that initial point. But for the most part, I never had any negative confrontations.
Good.
Not that it can't happen. So I don't want, I don't want to go there that it can't happen, but it didn't happen with me.
Right. So I'll ask then, the procedures. Can we talk about the procedures and how those changed over time?
Right. Well, over time, what they did was they gave us hand sanitizers. They gave us masks. They gave us goggles. They quarantined essentially those first few seats on the bus, and then they had basically everybody entering through the rear. As time went on, which is still in place right now.
So I'm curious. Clearly you said ridership is down now, right? So the people that are riding though, are they actually covered up? Do you feel secure about that, or
now they are?
Okay.
Now they are.
Okay.
I think like right now we've implemented that you can't essentially enter a public vehicle without a mask on. So
okay.
Including those who either were in homeless shelters or what have you, they have ones now. Right. So everybody has one.
Okay. So I'm curious. So my other question is, there's clearly things that you can do, right, yourself, right, to be safe, right? And I know that some of the things you said, you're also doing, like you have all your windows open, you have the top open.
Yes, you have the windows open. I have basically all the windows open.
Okay.
Because you're inside of a closed environment. You don't want that to stay. So you keep all the windows open. I have my driver's side windows open. I have my gloves on. You have these what do you call them right now? The liquids that for your hand, sanitizers and so forth. And then they actually have wipes now that you can wipe your steering wheel with. So every so many trips, I try to get up, walk around, go into the washroom, wash up, and they have this other chemical that they give us that, after you finish washing up, drying off, you place it on. It's like a foam, and then you rub it in. After a few minutes, it just, it's like a lotion.
Okay. And
you can basically have that on for up to 6 hours prior to washing again. So if you don't wash again, so long as you use that, you have that on, and you have your sanitizer, you have your gloves on, you're trying your best to keep the germs away from you.
So I'd ask, again, there's only so much that you can do for yourself, but if you had the opportunity to speak for other bus operators out there in the world, like what are the things that you would ask of other people that are coming onto your bus, or other people, things they could do to make you feel a little more secure about your job and what you're doing?
Well, I would ask them to adhere to the rules that we've implemented. Utilize the rear door, utilize, your mask. Obviously, you can't enter in the service right now without your mask. Utilize that, the common sense things, keep a safe distance between you and the other passengers, if you will. And now, I will say this, now that time has elapsed and we've had almost 3 months of being quarantined, if you will, you notice that people they need to get out now. Yeah. Like you can see it because the ridership, say on the last 2 weekends, has been much more considerable than a month and a half or two. Yes, absolutely.
But you're not talking about like half full, right? I mean. No,
you're talking about people are definitely trying to get out, go out, do stuff, and so. But you see that increasing, yes.
Mm-hmm, mm-hmm. So I guess Is there, so is before we hop, I just want to ask, is there anything else you'd like to perhaps even share for folks about your experience, or even things that'll, help prevent kind of the spread in terms of things you've seen on your buses?
Well, one of the things that you will see is sometimes, the younger folks will take off the mask,
On
right?
the bus.
On the bus,
Okay.
so, you'll notice that. And it's just one of those gentle reminders. No one has been negative when you remind them to, but I think they get, it becomes, if you're taking a long trip, it's a bit discomforting,
Yeah.
but you have seniors on the bus too. So you're not just reminding them for themselves, you're reminding them for the senior who's on the bus. So you just remind them gently, and for the most part they will. Obviously, I haven't had this experience yet, but you will have somebody who will mouth off. So that's inevitable. That's always going to happen.
Yep.
And you just gotta, let people know that, hey, this is not the time or place for any of that. So just do what your bus driver, what your operator says to do. Please, it's that simple. Don't make it any more complicated than it needs to be.
That's what's up, man. Look, I appreciate your time, man, and I hope you stay healthy, you and the family as well.
Absolutely.
And let's continue to stay in touch, man. Thanks.
For sure.
Take it easy.
All right.
So now we're gonna actually move on to another gentleman here. So that was great, and I think that will give us a little bit more insight into what it's like on the bus. But we're gonna have another gentleman here by the name of Will, and this is really interesting as well because a lot of us clearly are getting packages delivered to us on a daily basis. I, for one, know that when I get my packages, I have an entire routine over, getting it, wiping it down, or getting it, leaving it outside in the sun for a certain amount of hours, wiping it down, bringing it into the house. So we want to have this conversation with Will here about his job and what he's doing and about delivery, right? Will, how you doing, man?
Yeah, I'm good, man. I'm just getting home.
That's good, man. That's what's up. So, could you tell folks, and we don't have to go into specifics of the detailed name, but can you tell folks a little bit about what it is that you do?
On a daily basis, basically,
Uh-oh, looks like we froze for a minute. We froze for a second.
yeah, I get to work around 7:30 and, prepare myself for the day, sanitize my truck if they haven't already done it, and then just go on to sorting my packages and, delivering. But, it's scary out there, man, because you walking in, you got to wear a face mask every day, you got to wear gloves, and, it's just, it's already been a couple people in my job who had it already, so.
Oh, really?
Yeah, it's just trying not to get it is a challenge, So I mean,
one thing that's interesting, man, is you when we talked about a couple weeks ago, when we first talked about what you're doing, you have, and I think it's really important for people to understand what folks like you who are delivering packages are doing. You have an entire routine when you get to work, when you're cleaning down everything and your packages and everything. You have a routine before you're even bringing packages to people that I don't think a lot of people even know about. So can you share what your process is like?
it's for me, I get to work like a half an hour early. I go to my truck, I wipe everything down, because once I come back and at the end of the night, somebody else gets in my truck and they take everything out and so I clean my truck in the morning before anything. So once we sort the belt, then all the packages are in the truck already. So then I spray everything down. I even spray the packages inside the truck before the road.
Right.
You know what I mean? So that's my everyday thing.
Right.
Because I'm not trying to catch it. I'm not trying to bring it home to my family as well either. So.
Right. So let me ask. So clearly you're spraying down your packages. You're wiping down the inside of your truck. So it's safe to say, right, that it's safe to say before people are getting their packages, they're already cleaned, at least by you. But is that your process, or is that what you're seeing other people do as well?
That's my process.
Okay.
That's what I do. Yeah.
Okay. So let me ask this then. So when COVID hit, when this all hit and everything, how did that make you feel about your job and working directly with because you work with a lot of people, like, every single day. So how did that change your experience? I mean, what was your thought process when that happened? You were still having to be at work. and not knowing much about what this disease was?
Nah, I was extremely nervous.
Mm-hmm.
I was nervous about it. I was nervous about it, and when I first found out that somebody had it at the station, I took off 2 weeks.
Wow. Yeah.
And I had no vacation. You know, I just got married in September, so I used all my vacation for that. So I took off 2 weeks with no pay.
Wow. Wow.
Because of it. You know, and then, you know, you can't take off too long. So then I go back, you know, I'm doing everything. Then they started providing us with, you know, the gloves, the face mask, the hand sanitizer, cleaner for the truck. They started providing us with all of that stuff. So, you know, we got to take those precautions as well as them. So they gotta provide us with all of that stuff to be safe out there, you know,
Yeah.
if they want us to continue working.
So when that hit, how did your day-to-day job change? Right. So you said they started giving you protective gear, but like, what was the difference between like 3 months ago and now, right? Like, is there a difference with delivering with your people, your clients that you're seeing?
Oh yeah. Yeah, it's definitely a difference. You go from interacting with them, you know, talking to them every day and being close to them and them getting to know you as a courier. You know, I've been new on this route, so it's like you can't interact with them no more.
Mm-hmm.
So it's just like, here's your package, see you later. You don't want to get close to nobody because you don't know who has it. They could be a carrier, they have symptoms or anything. Mm-hmm. So it's just, I'm just trying to give them their package and get out of there. You know, either going from house to house to the doorsteps, it's like I drop it. We're not even allowing signatures no more.
Mm-hmm.
You know, so we basically don't want any contact with any clients or nothing. Just in and out.
So
I'm gonna crazy. So I mean,
so it was interesting too. Another thing you told me when we were speaking some time ago, you said that that now it's different. Like you have experiences where, or actually, let me even bring it back. I know when this first hit, and the first time someone rang my doorbell, ding dong, and I was like, "Who's there?" And this is, you know, some delivery guy, and I opened the door, and it was a very uncomfortable feeling. Like he had the thing to sign, and I was like, "Do I have to sign it? Can you just leave it there?" And part of me felt bad, but you had told me about a story with yourself, and you were saying that like you don't feel bad about that at all, right?
About what? Ringing people's doorbells, knocking on their door?
No, about people feeling that uncomfortable, like, please stay away.
Nah, I mean, you feel bad about it, you know, but it just they looking at you in a different way. They looking at you like you are COVID-19 walking up to their doorstep. You know what I mean? That's how they looking at you.
Right.
You know, I have people tell me, "Oh, just right there, just drop it in the grass or drop it in the driveway, put it on top of the car." You know, just they looking at me weird. Like, not that I want to do anything. If you let me do my job, just stay in the house and, you know, I'll put it in your doorstep like I'm supposed to.
Right.
You know, they just look at you different. Weird. I don't want to catch it no more than you want to catch it. I don't want to interact more than, you know what I mean? So it's just weird.
You know, that's a good point to put out there as well, to the fact that you said like you don't want to catch it as bad as someone else. I know that you've already been tested, you and your wife and your family, everybody's negative, thank God. But that's a good point you make. It's like you feel as though people are actually looking at you differently now in a negative manner.
Mm-hmm. But it's like, you know, that's because I've been tested negative. Don't mean I can get it. I can't get it. You know what I mean? So it's like I gotta take every precaution not to get it, just to, you know, keep everybody safe in the house. I mean, my wife's been home 2 months now, and I'm out here working, and everybody's here. So you know, can't not work.
Yeah. So let me ask you, if there's something, if you were able to speak right now for all, you know, for all delivery men out there, what is the one thing that you could say to people like us, right? To do things that you would ask us to do to make you feel more safe about your job and you going home to your family?
Basically, just stay home.
Right.
Stay home. Wear your face mask when you have to go out for essentials. Stay home, and that's it. Keep the distance, and just let the workers do their job.
Yeah.
Let everybody do their job. You see me coming up to your door, just stay in. Don't come out and yeah, reaching for a package or any of that. Just stay inside, drop it, then you come do what you got to do with it. You know, because I'm looking at you the same way you're looking at me.
Yeah, yeah. Well, look, man, I appreciate your time, man. Look, well, is there anything else you might want to say to folks? Anything you feel you want to get off your chest about this experience or what you're going through? Because I know, like,
Now we're gonna need a whole different live for this one.
well, look, well, look, man. I know. Look, your safety is important to me, man, because we're close and our families are close. So you know, I wish that everything, you know, goes fine for you. I will say that you know, that's a great point that you made about people looking at you differently, right? And it's I want to say again to the folks that are actually watching, treat these people as you want to be treated as well, right? They are equally as nervous about you, right, in your house, coming out to them and giving them COVID as you might be about them. So I can get that, man.
Mm-hmm. Exactly. Hey, just stay safe, man. That's it.
Yeah. All right. Well, thank you, man.
No doubt.
Appreciate your time, bro.
All right, bro. I'll see you later.
We'll chat.
All right.
Okay. So we have one more person here, and this should be really interesting. So we've talked to someone who is a bus operator and out there on the front line. We talked to this gentleman here, Will, who is delivering packages to your door. Now this is someone who has got literally hands-on with people. This young lady is a physical therapist. And as all of you are aware, there is nothing like when you're a physical therapist, you have to touch people, right? It is your job to touch people. So, Erin, how are you?
I'm good. I'm good.
Well, it's good to see you tonight. Good to
You,
see you again.
yeah, you as well.
So I kind of teed up your job, but like, do you want to maybe give a little detail about where you are or what you do?
Yeah. So I'm a physical therapist assistant. It's a PTA. My job is essentially to help people get strong. I mean, I work in a short-term rehab right now, where people, you know, say you broke your leg or you have a knee replacement or something like that, and my job is to help you get stronger to get back home, because maybe you have a, you know, two to 3 story house, and you know you can't, your bedroom and your bathroom is upstairs, and you know, obviously you got to sleep. A first floor setup's not feasible. Maybe you don't have someone who can help you at home. You know, people are staying with us to, you know, get a little bit stronger so they can get all the way back home, obviously to cover those stairs before they can get back home.
Yeah. So one thing you told me that was interesting about what you do too is that stays before were a day, 2 or 3 days, and now because of COVID, you guys are actually having patients stay there for weeks at a time, right? Yeah. And then quarantining there too.
Yep. So typical stay it was back when we first started, like 10 to 14 days, and then it got a little bit longer. Some things changed with, you know, obviously with COVID coming as well. So, you know, hospital stays are shorter for people, so to us more compromised. And then they're having to stay longer. Sometimes people don't go straight home. They end up having to go to a long-term care, but a lot of long-term care places are taking people shut down because of whatever might be, you know, going on in their buildings, the scares or whatnot. I don't know. That's really my job, but that is something that is happening. So people are having to stay longer.
Yeah. So to the point what I was saying earlier, as you were joining, your job is to physically, you have to touch people, right? It's not a job where you're dropping a package. It's not a job where you're picking people up or, you know, taking a credit card for someone. You are physically touching people. Yeah.
So more or less, I mean, you know, sometimes people, you know, really can't do things on their own. So I am in their personal space, you know, having to, you know, pick them up or help them walk or show them different techniques to move their bodies. That's what our jobs are as therapists at this level. So we are really in, you know, people's space, and, you know, you start to question, you know, do I really want to get, you know, that close? But then, you know, that is a part of your job. So you have to do it.
So I'm going to pivot just a little bit because I want to make sure that we hit on one thing real quick that I think is really important, because you're talking about being in people's faces and being in their, you know, close proximity. You caught COVID-19 on the job. So can you tell us a little bit about like that entire experience? Like clearly the fear of having to catch it, like you're touching people that like going through this, and then you're now catching it and having to go through dealing with this.
Well, things have been, scary, in the past couple months. You're going from a position of like, all right, I'm just going about my job, to now all of a sudden I have to wear, masks and goggles in a time where we didn't really have to do that. Had other precautions or restrictions. So you do that, you use PPE, you ditch it before you even leave the room, and then you go about your day. Things change. I mean, obviously you're washing your hands all the time. We were doing the masks and the goggles, but we didn't, unless someone had an actual being tested for COVID. You weren't gowning up. Well, things have changed now, so now it's the whole deal with the face shields and gowns and whatnot, and it's stressful. Okay.
Yeah, I can imagine. But then you also caught it, right? And clearly at work. So can you tell us what that experience was like?
I can. Every day we come in. Actually, I'll kind of back up to that. So every day before I even left for work, I always took my temperature. Back when all this was,
Wow.
What's the point of going to work if you have symptoms?
Yeah.
We were getting screened every day before we, before we go past the front, temperature screen, asking the question. April 30th, as of that morning, everything was fine. I was still my normal 97.6 low, and started going through my day, and I just kind of started feeling like, maybe I'm a little, my neighbor downstairs was a little loud first thing in the morning. I'm a little sensitive about my, last hour of sleep.
Mm-hmm.
And well, I'm just a little more tired than usual, but kind of as the day went on, I was like, something's not right here. And I actually ended up going to my boss and I said, look, this is what I'm feeling. I'm more tired. I'm even short of breath just talking to you right now.
Mm.
I'm leaving. I'm not even making the appointment to go to the doctor. I'm going right to an urgent care. Didn't know that the door was actually going to be shut for that, but I got to tell them the appointment. And by the next morning, I was tested, and actually that next day was probably one of the worst days that I had to deal with. And I knew that I was going to be home for 2 weeks. I just knew something was wrong. Mm. And that next, the 2 days after that, I started feeling not so great. I got that phone call that said, hey, you got it. Mm. And I didn't feel, I was like, okay, I'll be all right. And when you start to not feel well, and I'm not somebody who typically gets sick,
Mm-hmm.
I'm relatively young. Mm-hmm. I'm a former collegiate basketball player. By the nature of my job, I have to move. I have to be able to lift people, and like I said, typically get sick. So this was odd for me.
Yeah.
And it hasn't been fun.
I'm sorry you had to go through that. So let me ask now. So you're working with people on a daily basis who clearly some do have this because they are being quarantined there. You end up catching this. You're clearly, to some extent, I would assume, over it now, right?
Yes.
Thank God.
I'm over it.
Good.
Tomorrow.
So that was my next question. Now you're going back to work tomorrow. There's got to be an awkward feeling there, right?
Yeah. It's a little nerve-wracking. I'm by nature, a people person, and one of the gentlemen earlier kind of started saying, like, people start to look at you differently, even though, I may be fine. I may have the antibodies. I plan on getting the antibody test not right away, but yeah. Figure out, how to get back to what normal is. I'm going to be going back into, the building where, people may be looking at me differently. I don't know. And really the only thing that I can do, my job, I'm there to help people, get better. I had to ask me one time, was I scared of all this back when all this started? And the answer was no. Like, I don't have the luxury of being scared. I'm in healthcare. Essentially, I kind of signed up for this. So I have to be ready for anything. And I can't work from home. And my job is to help people get better so they can stay home and be safe.
Mhm. But that's a beautiful thing, right? And that's great to hear that you have that willingness to get back in there and help. Um, but there's also has to be a sense of hesitation, right? I mean, do you feel as though like you're gonna approach your job differently now?
You know, I don't know until I get there. Honestly, I'm not afraid to work. I've never been afraid to work. You know, I love what I do. I love where I do it. Looking forward to seeing some faces because it's been lonely
Yeah, I get it.
for the past 3 weeks. But you know, I'm looking forward to trying to get back to some sort of normalcy. I'm a little bit anxious about, you know, just physically going from not doing anything for, you know, 3 weeks to, you know, walking around for, you know, 8 hours and trying to breathe and you're half suffocating behind the mask. I'm not looking forward to the times that I did have to go out um, to get tested. I'm, you know, behind. I have an N95 here,
Mm-hmm.
and I'm not looking forward to it.
Yeah, I understand. So let me ask, what has changed from like then, even prior to right before you got this, to now in terms of your job? I mean, do you feel safer in that environment now?
Um, I'm walking back into the that I left essentially. Things did really change. I mean, we were a brand new state of the art facility, all private rooms, so nobody's sharing anything. And we have a beautiful gym with all this equipment, and all of a sudden we're not allowed to even, you know, be in the gym. You know, so we're crippled as therapists, you know, by not being able to use the tools that we're, you know, used to.
Mm-hmm.
And you know, families can't come and visit. I mean, it was such a bustling building, and now it's not. All the treats have to be in people's rooms, so they are essentially in jail. Like, and I truly feel like I said this a little while ago to a friend. You know, I feel like I work in a jail.
Wow.
So on from going to go see people who can't leave their rooms, and then here I am, you know, for the past 3 weeks being a prisoner, and it's it's very difficult. You know, it's very, very stressful. You have to be ready for anything, honestly. But I think it's more mentally taxing.
Yeah, understandable.
In a lot of ways, it's really tough. You know, you feed off of energy from other people, so it gets to be really difficult to even kind of maintain the positivity yourself. A whole routine for, you know, coming in the house and making sure I'm, you know, taking clothes off and put it in the bag and then run and shower and then come back and then touch the bag and put it in the bag, spray the shoes and wash your hands all over again. I have to go through all that all over. But I'll do it, but it's mentally taxing. There are a lot of days, you know, I came cried in the shower because it's hard to be on all the time.
Yeah.
You know.
Yeah. I can understand, and I'm sorry for that. I know that must be a lot to manage. I guess I guess I'll ask one more question then. What is it that we or people that are coming in to be helped at your facility, like what are things that they can do to help you feel safer about yourself and not having to go back to this experience again, or even perhaps bring this back to a friend or family member?
You know, it's hard because this is an airborne thing, you know, and it can take a while to show up. We haven't had any visitors or anything like that, so we don't have to worry about people's families really bringing it in. But I guess I would say, you know, to the patients and their families that to please continue to be patient with us. We are we are stressed and just as frustrated as you are with what's going on. But we're doing everything we can to help you kind of get back to where you want to be so that you can be home safe. As far as, you know, other people out in the world, I'm anxious about the world opening back up again. You know, I kind of, if I could put a plea out there to everybody, please, please, please think about it before you go out. You know, what I think kind of gets to me the most is that there are a lot of asymptomatic carriers out there. You know, I've worked with some.
Yeah.
and you just don't know. And, you don't know who you're going to come in contact with. Maybe freshly getting it, you don't know, and then you're hanging out with them thinking, oh, I'm social distancing. We don't know what you just walked into.
Yeah.
Just please stay home. Ask yourself, think outside yourself, think you're out there working. You don't need any more patients right now.
Yeah.
With particular, because it's really hard right now.
Well, look, we appreciate everything you do. I'm sorry you had to deal with some of the things that you've done, but you are an absolute hero for literally sucking it back up, dealing with a lot of this mental shit, and then getting back in there only a few weeks later, right, to do it again. So appreciate all that you're doing out there.
Thank you. Appreciate it.
Thank you. Thanks so much for your time.
No problem.
Take care, Aaron.
All right, you too.
So we heard some really powerful stories. I would like to actually have one more person actually join here. Wally, if you're there, I'm totally putting you on the spot here, but I'd love to have a quick conversation with you, Wally, about some of the stuff that we've just discussed here. Is she even on here? Oh no, she's not even on here. Oh, did she walk out? Give me 1 second. She might have just hopped off. She might have just left. All right, so I was hoping she'd be able to come on and just have a quick conversation. Look, folks, those are the three people that we want to talk to tonight, and I think, we don't want to have a celebrity every single time we have these conversations, because we also feel that it's important that we talk to people who are truly on the front lines and experiencing this stuff. Hold on, she's right here. Get on. So hold on, I'm gonna see if we can actually have her join us real quick to hop in on this conversation, because it's interesting. But the reason why we want to have these conversations is because it's important that we hear other people's stories, right? Like I don't know that we hear them enough, and we continue to see these numbers rise in terms of people of color that are passing away due to COVID-19. So for us, it's important that we focus on, again, health, right? And things like self-care, but really understanding some of the things that some of these individuals are going through, so that perhaps there's something that we can do from our side to actually help as well. I'm going to actually have Wally join. Now, Wally is one of my counterparts here who works on the Black Health Now initiative with us, one of three. Others, a gentleman by the name of Brian, but I just want to have a quick chat with her before we actually hop. Let's see if she can actually join in. She's coming in right now. Bear with us, folks, and appreciate everybody for sticking around for these conversation. Let's see. Hey.
Hi.
Wally, what's going on?
I'm good. How are you?
Good. So what I wanted to do real quick before we actually parted ways with everyone, I just wanted to kind of bring you back in here to kind of double back on some of the stories we've heard, and I guess really explain some of the importance of why we're actually wanting to have these conversations with folks, and the importance.
Yeah, I think this was great. And, we're so appreciative that you guys have, joined us tonight to really talk about the real life experiences, because that's important. And, as Walt and myself and Brian Gaffin, who are part of Black Health Now, really thought about, like, what can we help people really understand about what's happening with this pandemic, especially as it relates to Black Americans. It was important for us to hear from people on the front lines as well. So, we appreciate everything that people on the front lines are doing. It's really critical, but we know that unfortunately COVID-19 has really hit us harder than it has other communities. So, really understanding that point of view and diving deep into issues related to why is that? What can we do to take better care of ourselves? Whether that be from a health perspective, and that's a lot of the programs that we've had, to, the information that you all have shared tonight with how do we take care of ourselves each and every day when we need to be out there in the public. So it's really important for us to hear.
Cool. Any last words you might want to tell the viewers before we part ways, and teases to what's to come, at least, maybe?
Well, there's more to come from Black Health Now. Thank you, everybody, for joining. I mean, we really do appreciate people joining and coming on these live shows. Our goal is to really bring to the forefront, important issues that are happening with Black health, because we are all about Black Health Now. So thank you. There is more to come. As you know, Walter has definitely covered a lot of the bases, be it talking to physicians or talking to Marcus Samuelson, or, exercising and healthy cooking. But there's definitely more to come, because we really want to dive even deeper into the issue around, what's causing it, what can we do? And as we know, we need to continue to be healthy and care about our health long after COVID leaves us, which hopefully is soon. So, let's continue to talk about the issues that are important to us. So stay tuned for more.
Yeah, indeed. And one last thing I want to leave folks that are actually watching here with is that the hashtag Black Health Now is like something that we started, but it's not ours, right? So if you want to speak your voice, if you want to talk about issues that you're seeing, if you want to reach out to us about conversations that you feel are appropriate for us to have on this platform, raise your hand, reach out. We'd love to talk with you. Share your story, hashtag Black Health Now. We'll promote it. We'll push it out there as well. This is a platform for all of us to help activate, not just us here.
Absolutely.
Thanks so much, Wally.
Yeah, thank you.
Take care. And thank you, everybody, for joining us tonight. More to come. Follow, watch. We have some exciting stuff on the way. Thanks, folks. Take care.